Welcome to your journey to wellness at Liberty Hospital. I'm Lisa Boyd, and I'll be walking you through your joint replacement orientation today. The world of joint replacement has changed in the last few years, and now that everything is more of an outpatient procedure, we really need to make sure you're as healthy and as active as possible before surgery, and that you're also prepared to have surgery and rehab at home. This is why this orientation and a pre-surgical testing appointment that you'll be scheduled for are so important. When you come to pre-surgical testing, you'll be provided with exercises specific to your procedure. This is really important to start these exercises ahead of time to strengthen your muscles and prepare them for surgery. We'll go over these when you come in, but one thing you need to start working on right away is getting your home ready. The things to consider are: how are you going to get in and out of the house? How many stairs do you have? Physical therapy will help you go up and down any stairs before you go home. However, if you have more than 1 or 2 stairs, you really should have a handrail to make going up and down the stairs much easier. You will need to make sure you have a clean home with clear pathways and that you and your walker can fit wherever you normally walk in the home. You need to make sure you have a good area in your living room where you can sit up in during the day. It's better for your lungs, your bowels, and your circulation if you're sitting up in a chair throughout the day. Chairs with arms are easier to get in and out of, and you'll want to make sure your chair isn't too low. The easiest way to fix a chair that is too low is to stick a pillow or two underneath your bottom and just make sure you can keep your feet elevated during the day. Next, check out your bathroom to make sure you've got it set up safely. Some patients choose to purchase a shower seat to sit on during a shower, or you can purchase stool risers that sit over your toilet with armrests to help you push up from. Those 2 pieces of equipment are not required and they are not covered by insurance. If you do need them, we can give you tips on where to purchase those before surgery. Your next step is making sure you have help at home. You need to be able to have help with cooking, cleaning, laundry, and shopping, and transportation. It will probably be at least 2 weeks before your surgeon will release you to drive, sometimes longer. Making sure that you have assistance at home is key on this journey. Your next step is 1 week before surgery. You need to make sure that you're not taking any aspirin, Excedrin, ibuprofen, or any vitamins or supplements that could thin out your blood. You need to make sure that 3 days before surgery, you're not shaving that surgical leg or putting any lotions, creams, or ointments on that leg to help prevent infection. When you come for pre-surgical testing, we will give you a bottle of soap called HibaCleanse, and you'll use that soap the 4 nights before and the morning of surgery. We're kind of particular on how you use that soap because it does help prevent infection, and we'll go through those instructions at your pre-surgical testing appointment. The day before surgery, you'll want to stay hydrated since you won't be able to eat or drink anything after midnight. So drink plenty of water. If you're not a good water drinker, you could also do Gatorade or sugar-free Gatorade. You want to make sure that you have a bag packed. When you're here, you're going to get up and dressed in your own clothing. You feel better when you're in your own clothing, and you do have to get dressed to go home, so make sure you have tennis shoes, no flip-flops, or anything you're going to trip over. You'll want to pack shirts and undergarments that are comfortable. And for pants, we usually recommend you wear gym shorts, sweatpants, pajama bottoms, or something with an elastic waistband. Remember, you'll be doing exercises while you're here, so comfortable clothing that's easy to move in is important. If you already have a walker, we will ask that you bring that with you. That way we can make sure we adjust it for your therapy and make sure it's in good working condition. The day before surgery, you'll do that 4th HibaCleanse shower, and then nothing to eat or drink after midnight, and that includes no gum, hard candy, and no smoking at all. If you have any medications to take the morning of surgery, we will write that down for you. You may be given a bottle of Gatorade to drink the morning of surgery. If so, we will go over those instructions very clearly with you. We're very careful about what you can and cannot drink or how much before surgery so that your surgery does not get delayed. On the day of surgery, you're going to come in the main entrance of the hospital and check in at registration. Then we'll get you to the preoperative holding area where they're going to get you ready for surgery. They'll start your IV fluids, and get you into your hospital gown. We do give you IV antibiotics before and after joint replacement, but you will not have to go home on any antibiotics. You'll see your surgeon and the anesthesiologist the morning of surgery, so you'll always have time to ask questions and address any concerns before your procedure. When you come in for your pre-surgical testing appointment, your navigator will go through your specific surgical procedure with you, but in general, we do clean your leg before surgery and wash that joint out after surgery. Your surgeon will close your incision, and then we'll go over wound care and showering with you. The 2 biggest risks really of any surgery include infection and blood clots. You're most at risk for infection after the first 2 weeks. What we're watching for is a fever above 101.5 and a red hot incision. I like to describe that as if your incision looks like it got a bad sunburn. If you're draining pus or even just a lot of clear yellow fluid, your surgeons are going to want to know about that right away. There's a lot of things that we do here at the hospital to help prevent infection, but there are things that you can do, including washing your hands with soap frequently, especially before you go anywhere near your joint replacement, and then just keep your incision clean and dry. Don't pick at it, don't poke at it, don't put anything on it, and don't put it underwater until your surgeon says that it's okay to do so. You may want to talk to your surgeon before you resume any dental cleanings or dental work. They usually have you take an antibiotic before you go to the dentist. Preventing blood clots starts today. What we're watching for are things like blood clots in your leg that can cause swelling, pain, redness, and warmth in your calf. You can have a blood clot that travels to your lungs, which can cause chest pain, trouble breathing, or sudden onset of confusion. To prevent blood clots, we get you up and moving right away. We're going to have you start your exercises ahead of time, and we want you to walk as much as possible before and after surgery. One of your exercises that helps prevent blood clots is very easy to do. It's called an ankle pump, where you just pump your feet up and down like you're pushing on the gas pedal, and that'll help keep your blood pumping in your legs. You'll get sleeves in the hospital that pump up and down on your calves to help with that blood flow as well. You also get some very lovely thigh-high compression stockings that you get to wear every day and night until your surgeon says otherwise, which can sometimes be up to 8 weeks. After your surgery, we're going to get the incision on ice and you're going to be able to elevate your legs. You're also going to be on a blood thinner, and it's important not to skip any doses. In the recovery room, when you wake up, you'll have oxygen in your nose and a monitor on your finger. You'll want to take big, deep breaths in through your nose and out through your mouth. We'll do an x-ray of your surgical site, and if you're having a hip replacement, you may wake up with a pillow in between your knees. As we mentioned previously, it's important to get you moving right away. Our goal is to get you in a wheelchair in the recovery room. Pain management is a big question that a lot of patients have. Joint replacements are not pain-free, however, the pain after surgery is much different than the pain you were experiencing before surgery. To help with that pain, we do give you ice packs to go home with, and it's important to keep your leg iced and elevated. Distraction is also a very good non-medication way of helping with pain, whether that's reading a book, coloring, or listening to music, or playing a game on your electronic device. We do usually give you 2 extra strength Tylenol every 8 hours for pain, and then a narcotic in between as needed. The goal of pain management is to make sure that you are asking for pain medicine before your pain is out of control. Technically, you do have to ask for pain medicine, but we do give you frequent reminders about pain and medication. We use a 0 to 10 pain scale at the hospital. When you're rating your pain, if you say you have mild pain, which would maybe be like a 3 or less, that would be the equivalent of taking Tylenol for your pain. If you have moderate pain, that would be in the 4 to a 6 or 7 range, and that would be the equivalent of 1 pain pill to manage pain. Then that 8 to 10 range is severe pain, and that would be the equivalent of 2 pain pills to manage your pain. We like to give that education about that ahead of time so that patients can start thinking of their pain on that scale. The daily schedule when you're here is very routine. We check your vital signs every 4 hours, perform hourly rounding, and bedside shift reports, so we're checking on you frequently. At night, these checks can be a little cumbersome, so we try to cluster care, meaning when we come in to check your vital signs, we'll ask you if we can fill your water or if you need to use the restroom. Can we give you a snack so you can take some pain medicine? You're going to hear the phrase, "Is there anything else I can get you while I'm in here?" a lot, and that way you have time to rest in between care. We give you friendly reminders that you are considered a fall risk while you're in the hospital, and that's just because you've had surgery on your legs. So you really need to make sure you're asking for help if you want to get up out of the chair, out of bed, go to the bathroom, or move around. We do get you up in a recliner during the day so you're sitting up for meals. It's better for your belly if you're sitting upright when you eat. Physical therapy will see you the day of surgery and usually twice the day after to make sure you can get in and out of the chair, in and out of bed, walking with the walker, doing the exercises, and getting up and down any stairs you might need to be able to go home. And then we're going to have you do a breathing exercise called an IS, which you'll get more instruction on in the future, as well as those ankle pumps we mentioned earlier. You'll do those 10 times every hour when you're awake so that we keep your lungs nice and clear and keep that blood pumping in your legs. Occupational therapy will see you the day after surgery and will work with you on dressing and grooming and making sure you can reach your feet to put those stockings on and making sure you can do what you need to do, minding any restrictions you have. You can sleep on your back. You're probably going to want to get used to trying to keep your toes pointed towards the ceiling. This tends to be much more comfortable for patients than kind of rolling that leg outward. We will also help you sleep on either side if you're able to. Certain hip replacements you cannot sleep on your incision, but if you'd like to sleep on either side, you'll just want pillows in between your knees for comfort. If you've had a knee replacement, we'll also show you how to roll a pillow underneath your heel so you can get your knee all the way straight after surgery. When you leave the hospital, you will receive a lot of instruction and everything's written down for you. This also includes planning ahead and making sure you have good nutrition at home. It's really key to healing. You'll want good protein and calcium snacks like cottage cheese, eggs, yogurt, peanut butter, and nuts on hand. If you can't do 3 meals a day, that's okay. Some patients' appetite just isn't 100% right after surgery. But if you can't do 3 meals a day, do small, frequent snacks throughout the day. If you really aren't eating well, you need to make sure you're supplementing with some kind of nutritional drink. You'll also want to make sure you drink plenty of fluids and eat lots of fiber, which helps prevent constipation. That's a big problem after surgery, especially when you're taking pain medication. One of the most common questions patients ask is, when am I going to be back to my regular activities? And it's really important to understand that this is definitely a journey. It can be a couple of weeks before your appetite is normal. It can be 4 to 6 weeks before you sleep through the night, and that just has to do with the need to frequently reposition. 6 to 8 weeks is how long knee replacements have to get that range of motion back. Otherwise, scar tissue can set in and it can really limit you. Some hip replacements have certain precautions that they have to follow for 6 to 8 weeks. By 12 weeks, or about 3 months, most patients are doing the activities they want to be able to do, and they're kind of back to their usual self. Your surgeon may have mentioned that it can take a full year to completely recover from a joint replacement. That's because you can have pain and swelling that can come and go, and that can last up to a year. On the short end, we do have some patients who have 1 joint replaced and 6 weeks later have another joint replaced. Your nurses, therapists, physicians, we all keep you updated on how you're doing. We give a lot of encouragement and we mean it, but we will also tell you if there's anything that you need to work on. Thank you for watching. Feel free to watch this orientation as many times as you need to, or to read through your orientation book as much as you like. If you do have any questions, please don't hesitate to call your orthopedic navigator at 816-792-7053. Thank you.